Hello, everyone, and welcome to the Happiness Uncovered series. Today, I'm privileged to chat with my friend Erin about nutrition in happiness. So, how does what we eat affect how we feel? So, please, Erin, thank you for joining me, and please tell me something about yourself.
Hey, hi, Pirjo. I'm really happy to be here. Thank you for inviting me. So my name is Erin Maurer. I am based out of Switzerland in Europe. I work with a company called Mason and Lantz. We provide nutritional programs and support using low carbon ketogenic nutrition therapies. We collaborate with researchers and medical professionals internationally to help support them in their research and in making nutritional therapies more accessible. I came to this work because I and some of my family members had some pretty severe health issues, and a physician pointed me in this direction, for which I'm very grateful. I use ketogenic nutrition therapy to manage my own health, and I've worked with people from around the world with different chronic diseases and disorders to help them do the same. And in fact, a lot of the work I do is with people who struggle with mental health.
Okay, so yes, it's amazing that you say that you met this physician because I believe that we don't meet anyone by mistake or whatever. It's meant to be that we cross our paths with certain people with they bring us blessings or they bring us challenges. But let's dive deep into this nutrition part. So how does ketogenic diet fundamentally affect brain function and mood?
That's a good question. Okay, so I think before I answer that directly, I will give you just a little bit of background information so you understand my answer. Um, we have come so far when it comes to research, and we still have so far to go, but we're coming to understand that the function of our brains and our moods, along with that, are strongly affected by our metabolic health. And what I mean by metabolic is just the chemical processes that keep us alive, how our body converts food for energy, how it makes and breaks down molecules, how it gets rid of waste, things like that. So when it comes to our brains, a lot can affect our brains, our genes, our chronic stress or trauma, our environment, nutrition and lifestyle, right? These all have effects on the metabolism and function of our brain. So we don't have control over some of these things. We just don't. However, there are things we do have control over. We have a great amount of control over what we put into our bodies, for one thing. So, nutrition and lifestyle. One of the most important things we can do to help support healthy metabolic function in our brains and thereby help stabilize our moods and just run properly up here is to make sure we're not damaging our metabolic health with the stuff we eat and drink, right? So while it might be enough for some people to simply switch to a whole food diet and, cut out most added sugars, for people who are already metabolically compromised, so whether they already have a chronic disorder or disease neurologically, or they struggle with mental fatigue or energy or cognitive function or anxiety or whatever, or they're heading in that direction, or if they simply have a family history of some kind of metabolic dysfunction, certain nutritional measures might need to be taken in order to prevent or to manage and even sometimes reverse symptoms. So, metabolic dysfunction in the brain, again, it can be epilepsy or dementia, it could be mental illness, it can be, again, like I mentioned, autism, anxiety, ADD, right? Anytime the brain is not functioning like it should, then there's metabolic dysfunction. So the ketogenic diet is actually a metabolic therapy. It was originally developed to treat metabolic dysfunction in the brain. It was, and it still is, used to treat epilepsy, And now, over the past decades, we're discovering that it can be used to help manage and treat metabolic dysfunction, not only in the brain, but all throughout the body. So back to the brain, it's very good at helping treat even some of the most severe mental disorders like bipolar and schizophrenia. They have some great studies out about that. So now I can get on to answering your question, so you'll have a little bit of background there. To help explain how nutritional ketosis can affect the brain, it's important to understand where the brain gets its fuel to keep everything alive and running properly. Okay, this is because how well your brain is able to get and use the energy plays a really big role in how it can function. So the brain has something called the blood-brain barrier. It's like a protective wall around the brain that controls what substances can enter from the bloodstream into the brain. There are a couple of sources of fuel that can cross this blood-brain barrier to run things up there. So glucose is one of them. Glucose is a simple sugar. Your body gets it from carbohydrates. So carbohydrates break down into sugars in your body, and glucose is one of them. Most people's brains are fueled mainly by glucose because most people get all the sugar they need and more through their carbohydrate intake. Another source of energy is alcohol. It can cross the blood-brain barrier. We're not going to talk about alcohol because nobody should be fueling their brains with alcohol. The other source of energy, and this is a really important one, is ketones. And ketones are molecules that are produced by the liver when the body breaks down fat for energy. So when is the body breaking down fat for energy? Okay, this can happen during periods of fasting when the body has burned up all of its sugar and then it moves on to burning fat. Or it can happen when a person cuts down carbohydrate intake enough to tell the body, "Ooh, I'm not getting enough sugar, let's switch to fat." Okay, a ketogenic diet restricts carbohydrate or sugar intake to the point that it causes your body to start using fat as its main energy source. This includes producing ketones from fat in the liver, and some of those ketones go to the brain. They do provide a great and a clean, sustainable energy source. One last thing, as more and more people become metabolically compromised, the majority of them also develop some degree of insulin resistance. And insulin resistance, if I can describe it like this way, it means you can put sugar into your body, but your body can't use all of it. It's like if you were to stuff your fridge full of food and you put a lock on it. It's there in the body, but you just can't access all of it. It means that when this happens with insulin resistance, it means there's also not going to be enough sugar for your brain, no matter how much you put in your mouth, right? If you're not fasting, and you cannot fast forever, and you're not on a ketogenic diet, then there are no ketones for your brain to make up for that loss of glucose energy. So a sustained level of energy from ketones on a ketogenic diet has a powerful effect on the brain as it can provide the brain the energy it needs. So that was kind of long.
That's so fascinating. I mean, so fascinating. And that fridge example was so, it tells so much. It makes it more understandable. And yes, I remember that a few years ago when I had my stroke and I was at the hospital, the nurse told me that the keto diet is for people with epilepsy, totally in use also here. I think it's brilliant that in Finland, in hospitals, we have something like this because in a way, I feel like we are not so open yet to nutritional treatments and how it really affects what we eat. And I'm happy to hear that people are getting more and more aware about this, that what they eat, they are responsible for it. And especially we are all responsible of our own health and taking care of it. So Erin, in your experience, What are the most significant mental and emotional benefits of adopting a ketogenic lifestyle?
Oh my goodness. Well, yeah, I have seen a lot of benefits. I'll name some: improved mental clarity and focus. And this is just not me just seeing it in people that I work with, but also my colleagues, also medical professionals and researchers, and also in the studies that they're doing. So, improved mental clarity and focus, improved memory, stabler moods, reduced anxiety, better stress management, increased energy levels in the brain and just overall. And I've seen it successfully manage depression. I have seen it stop hallucinations and psychotic episodes. I have seen it stop nightmares that come with some of these mental illnesses. Um, and of course, I know it might not sound like something that would affect the brain, but it's really good at weight loss too, which for a lot of people relieves a great psychological burden. So, I mean, that's there. But overall, I've seen it give people a better ability to cope, to function, and really get more out of life.
Okay, that's important because here in Finland, I think that we have quite high depression rates. And I myself, I believe that the medication is not a good thing for most. Of course, there are people that it's very useful, but for most people, they should seek nutritional help instead. And I hope that people who are listening this maybe now try this ketogenic lifestyle. So, can you explain the science behind ketosis and its impact on cognitive clarity and emotional stability?
Yeah, as I mentioned before that when the body doesn't get enough glucose from carbohydrates
Yeah,
over a period of time, it simply shifts its primary fuel source to fat on a ketogenic diet.
yeah.
And of course, and I mentioned that some of it is broken down into ketones in the liver, and that can be used throughout the body for different purposes, including in the brain. And so, here are a couple of examples of how ketosis can affect the brain. It does increase the production of a certain protein, BDNF for short. It supports the growth and the survival and the function of neurons. So higher levels of BDNF are associated with improved cognitive function, synaptic plasticity, and mood regulation. Ketones also modulate neurotransmitters. They influence the levels and activity of various neurotransmitters in the brain, including serotonin, dopamine, and GABA. Being in a state of ketosis also reduces oxidative stress and inflammation. That's one of the really big things it does. And both of these things contribute to different neurological disorders, including mood disorders. So also on a ketogenic diet, stable blood sugar levels mean fewer insulin and glucose spikes. This, plus the added energy provided by ketones, can prevent brain energy crashes and the associated mood swings. And so all of these things, these factors help regulate mood, increase motivation, increase emotional resilience and stability, improve learning and memory, and improve cognitive function.
Amazing. I mean, it's
It
really,
is amazing. I'm not even a
yeah,
scientist. I can't even tell you all the fascinating things it does, but look it up.
yeah, yeah, awesome. So, Erin, what are the common misconceptions about the ketogenic diet regarding mental health and well-being?
Well, a lot of people think that the brain only runs on glucose and can only run on glucose, and that's actually incorrect. So they think, these are people they're just unfamiliar with the science, that's all. I've already talked about how ketones can fuel the brain very well. And the latest studies on mental health and ketogenic diets are absolutely amazingly in favor of ketosis as an optimal fuel for the brain. Another thing, some people think that keto makes your brain tired. It can cause, your brain fog, and also, physical fatigue too. And this is a common misconception sometimes. So when you go on a ketogenic diet, there's a transition phase between the metabolic pathway that your body uses to burn sugar as the main source of energy and the metabolic pathway that it uses to burn fat as a main source of energy. And during these several weeks, particularly maybe the first 1 or 2 weeks, people can experience some kind of fatigue because the brain, the body isn't quite as good with the fat yet, right? It needs a couple of weeks. And if people go the first week on a ketogenic diet and they're feeling tired and maybe, not having energy, and then they think, oh, keto causes brain fog, and it doesn't. It's just that, you have to get past those first couple of weeks. Anyone who's mentally fatigued after the first several weeks on keto, they're either not doing something correctly or there's some other factor affecting their health. The other thing, oh gosh, there are a couple more things. Some people say it's too difficult, it's unsustainable. I mean, if you don't do it right, if you don't have any support, any kind of nutritional change is going to be hard. For those of us who do it, we find it to be very sustainable, and it's not too difficult. A ketogenic diet is not just a weight loss diet. Some people call it a fad diet. They see it on the internet. They see all kinds of weird stuff on the internet. It's a fad weight loss diet. Lose 1,000 pounds in 3 days. It is ketogenic diet is probably the most successful type of weight loss diet. That is true, but it has health benefits that go far beyond that. It is a metabolic therapy used in medical ways. Some people think that it's a one-size-fit-all thing. Keto is this and not anything else. That's not true. A ketogenic diet can be as versatile as we are. It can be adapted to fit tastes and needs of each individual, and also to fit their health circumstances. And I think maybe one more thing that I can think of, people worry they're not going to get all the nutrients they need on keto, and that's really not true. With proper planning and attention to food choices, preferably whole foods, a well-formulated ketogenic diet can provide all of the essential nutrients that most people need to stay healthy. A lot of people who go keto actually end up getting more nutrients from their food than they did before. So, yeah, that's all I can think of.
That's so fascinating, and especially that I catch the word metabolic therapy. So it's very. It feels like it's both to it's also psychological, but also what happens inside you when you do these changes in your lifestyle and nutrition. So, could you please share any patient or client stories where the keto diet has had a transformative, transformative effect on their mental health?
Yes. In fact, I have permission to share the story of my own daughter. And so this is one of the reasons that, I came to it aside from my own health problems. So metabolic dysfunction runs in my family just very heavily. And one of the ways that it manifests itself is through severe mental illness. And so my daughter was diagnosed with bipolar disorder, with psychosis, at a very young age. And she, we were fortunate to be able to see doctors in different countries, and to be able to see some of the top psychologists in the world and get some of the top advice when it comes to, medications and different things like that. And so, she struggled, again, from a very young age with these bipolar episodes, and also with psychosis and with hallucinations. And it was just very difficult for her. She could not
Yeah.
live a normal life for a number of years until she got into her teen years, and we were directed to the ketogenic diet. And so, but she had been on some medications, and medications, you know, as you say, I mean, we never say, you know, we never tell people. There are people whose lives have been saved by medications. My daughter
Yes.
is, you know,
Yes.
my daughter is
Yeah.
one of them. You know, I'm very grateful that she had help and that she had those medications. And then, you know, I'm also very grateful that she was able to get off of them. So with the ketogenic nutrition therapy, um, you know, in her teen years, she was able to move away from very strong medications, and she's off all of her medications, and she's asymptomatic. She has not had any of the symptoms of her mental illness since then. And you know, one of the things I should point out is these medications have really nasty side effects. And while you're saving yourself on one hand with the medication, and please go see a doctor. And if you need medication to save your life, then do get some. But on the other hand, they have some really nasty side effects. Sometimes, you know, kidney disease, other things can develop because of their long-term use. And the wonderful thing about the ketogenic diet is you can, and this was the case for my daughter, she was on drugs that would eventually cause her kidneys to fail, but they were saving her life and helping her function in a somewhat normal manner. And now she has the same, well, a better effect with the ketogenic diet on her body and her brain, without all of the side effects. Right. And so she lives an asymptomatic life. She treats her illness with the ketogenic diet. Were she to go off the ketogenic diet and start eating, you know, huge amounts of carbs again and all kinds of things, the likelihood that she would relapse is very great. So it is something that she uses to control her symptoms, but she can live with that. And that's a wonderful thing. That's a very wonderful thing.
That's so awesome to hear. I'm happy for your daughter and you, of course, because it's as a mother, it's I can relate that it's difficult if something, whatever is going on with our kids, it's very difficult to
Yeah.
watch. And about the I believe that it's easier and in a way cheaper to take care of yourself and take a full responsibility of yourself now before anything else happens, or if something happens, to manage it yourself, because if you go to if you develop any kind of disease and you get medicine for that, and maybe it's good, maybe it's not, but if that severe side effects, that's expensive. And I don't speak now about money. I speak about all the stress and all the worry that comes. So it's really important to take care of yourself. So how does the keto diet influence the production of neurotransmitters like serotonin and dopamine?
Okay. Yes. Um, so neurotransmitters, for anybody watching this and who doesn't know, they are chemical messengers, right? That they transmit signals between your nerve cells, your neurons, right? And they are created by specialized cells in the brain and in the nervous system. They are important for communication within the nervous system, and they play a super important role in regulating mood, behavior, cognition, and other physiological functions. So super important. A couple of things. Ketones can increase the availability of tryptophan that is used to produce serotonin. This means better serotonin production in the brain. Ketosis increases dopamine production in certain brain regions. Chronic inflammation also alters neurotransmitter systems, okay? And it does affect serotonin and dopamine. The ketogenic diet has an anti-inflammatory effect on the brain. Another thing that's important, stabilizing blood sugar levels and lowering insulin, it influences neurotransmitter levels and mood regulation. It's important. One of the hallmarks of mood disorders is this disruption of glucose metabolism when, the body isn't able to deal with glucose like it should. In fact, we were just talking about medications. A number of medications used for epilepsy that are also used for mental illness work partly because they actually improve glucose metabolism, right? A ketogenic diet corrects this problem as well. It does it and improves neurotransmitter levels and function without the nasty side effects of a drug. So
Yeah. Awesome. That's so good to hear. So, are there any potential mental health risks or challenges associated with transitioning to or maintaining a ketogenic diet?
So mental health risks, first, I would say just overall, there are very few things that would stop where I would say you absolutely should not go on a ketogenic diet. And there are certain disorders that prevent someone from metabolizing fat. So they actually can't use fat for energy. And that would be very dangerous. They aren't common. And if you've got one of these disorders, you've probably been diagnosed as a child with it. It would have been noticeable. As far as mental health risks, if you are suffering from a severe, mental illness, and it doesn't happen to everyone, and to be honest with you, I've never seen it happen in anyone that I've worked with, but I've heard it, happen with other people. It's just a risk, is that in the transition phase of the diet, when your body is again moving from one, way of metabolizing energy to another, from the glucose to the fat, some people can find that they react to that mentally. So symptoms might potentially get a little bit stronger. And that's something that you would, want to work with your therapist or your psychiatrist, psychologist, whoever you're working with, who can help you sort of bridge that gap. I mean, that little time period, should it happen. The other thing, we would always say is that if you are on any drugs for mental health, that you should never just drop the drugs and start a ketogenic diet. Again, because of this risk as well. But, going off drugs is something you want to do with your doctor and in a safe way. And it can take some people on a ketogenic diet to have the effects that could replace the drugs. It can take, up to 3 months. And for some people, maybe a little bit longer, maybe up to 6 months. So it's not a safe thing to just take your going off meds into your own hand just because you're going keto. So I have to put that out there. And the last thing I think I would say is and this would be generally for anybody, following any old keto plan, right? You find on the internet, you can find all these things on the internet. It might work for some people, but it will not be safe for others. Okay. So that being said, once you know how to do it safely to support your particular health circumstances, then it could be something that transforms your health for the better.
Yeah, exactly. And what I've noticed that when I do a Google search on recipe ideas, those some of those recipes I have found are very good, but there is also recipes that it say it's keto, but it's not. So yeah, so you need to know, and I highly suggest you viewer to contact Erin if you want to do it safe way. So so how do you recommend someone interested in the mental health benefits or keto get started in a safe and effective way?
Oh yeah. Well, I guess we've made a couple of those points already. I mean,
Yeah.
if you're on medications or you've got any kind of chronic disease or disorder, or if you're at risk for a chronic disease or disorder, then it's a good idea to consult with a professional who is familiar with ketogenic nutrition therapies, because there will be added things that you're going to need to work into your nutrition. So very important, educate yourself first. So for anyone who wants to go keto, it's important to do some research and possibly undergo even a bit of training when it comes to adjusting and troubleshooting on the diet. You have to know how to be able to adjust and troubleshoot. Otherwise, you will not know what to do when issues arise, or when you need to, make optimizations, how you need to make changes. I hear people sometimes say, hey, I tried a keto diet and it didn't work for me. And, and I ask them, oh, what did you eat on your failed keto diet? And why did you feel it didn't work? What happened? Almost always the issue was that something that could have easily been fixed had they had the knowledge of how to use the diet properly, which is sad, because then, I see these people with these health problems and they say, I went keto for a week and it was horrible and I didn't know. And then I realized that, oh my goodness, you just didn't know what you were doing and you could be healthy by now, so it's hard.
Yeah, that's
It's also
sad.
important to look for credible sources of information. And, I have to go back to the education thing here. If
Yeah,
you don't understand the diet, how will you know what's credible? Like with you looking at recipes, if you don't understand what keto is really, any old keto recipe, you could use it and not be keto, right?
yeah,
Particularly if you're getting your information from sources who aren't trained in ketogenic nutrition therapies. There is a lot of good information out there. Don't get me wrong, there is. But you need to be
yeah.
able to recognize what is credible, what's really useful, and what is not. Remember that keto is not one size fits all. I mean, if you have kidney disease, for example, and you just eat whatever you see on the internet on a ketogenic diet, you could really damage yourself. Whereas if you know what you're doing, you could use keto to help prevent kidney damage or even manage kidney disease. So, and I think the last thing maybe would be to realize that sustainable change takes planning and preparation. Once you've educated yourself, decide how fast you want to transition onto a ketogenic diet. Are you going to start by lowering your carbs, maybe cutting out added sugar? Or are you going to start by changing your meals over several weeks? Are you going to start from one day to the next? I mean, your planning and preparations will partly depend on how you want to start, and so.
Yes, yes. Fascinating and important. So, what role do ketone supplements play in enhancing cognitive function and mood for those on keto diet? For me, I have these electrolytes here on my water and it tastes so good.
Well, this is such a good question. Ketone supplements. If I were someone selling ketone supplements, I would tell you that everyone in the world should be on ketone supplements. However, I am a nutritionist and while we do use ketone supplements for some people, let me answer that question. So when a person is in nutritional ketosis because of the way they're eating, so their body is producing ketones, right? We categorize the level of ketones available in the blood. Anything above 0.5 or 0.8, depending on who you ask, is considered being in nutritional ketosis, okay? So levels between about 1 and 3 are considered optimal, although that really depends on the person and how they feel. Levels between about 3 and 5 are considered optimal for certain therapeutic purposes. So for some diseases. So for some people, a blood ketone level of about 0.8 is enough to feel great and see a relief of symptoms. For others, getting into a deeper state of ketosis or getting higher levels of ketones is really what they need and they feel best with. There are different ways to achieve these higher levels, okay? So generally, a person doesn't need supplements to do so. On a ketogenic diet, of course. You can get even therapeutic levels of ketones without adding a supplement. But for some people, it's easier to add a supplement. It can allow for more flexibility on the diet, perhaps a slightly higher carbohydrate intake. Sometimes taking a supplement might also make sense due to individual health factors. For some reason or another, based on someone's particular health issues, sometimes they need the ketones to reach higher levels because they need maybe therapeutic levels or something like that. And for some reason or another, they have to follow the plan a certain way. It's just really an individual thing. Now, for mental health, someone might think, I don't need to go keto for added brain energy. I can just take a supplement, right? And I have two things to say about that. You'll have to take a lot of supplements to get the same sustained level of ketones that you would get on the diet. And ketone supplements are not cheap. They're not. And the other thing is neurological health and well-being. And we kind of talked about it a little already. But neurological health and well-being benefits from more than just getting energy from ketones and having those added benefits. Blood sugar and insulin control are also very important. And that is something that you can achieve on a low-carb diet. Ketones by themselves are not going to give you that blood sugar and insulin control. One thing maybe that I could say is, you can always take them, and if you feel better and you like them, that's great. We would suggest going on a ketogenic diet and then deciding whether or not you want to add them on top. If you can't do a ketogenic diet for some reason, or you just really don't want to, then at least a lower carb diet, whole food based, with the addition of ketone supplements.
Yes, awesome. So it's like those food supplements and stuff, nutritional supplements, they might even contain items that are not good for keto. So I'm very happy that you said yes to my supplements. So one last question, Erin. So in your view, how sustainable is the ketogenic diet for long-term mental health and overall well-being?
Yeah, in my view, from what I know and from my and others' experience, a well-formulated ketogenic diet, is sustainable long-term. You can still enjoy good food. You won't be hungry. That's really important. You don't go hungry. You can enjoy probably most of the foods that you like, that you're used to, but with some ingredient modifications. There are also different ways to transition to a ketogenic diet to make the whole process easier and more sustainable. Remember, it's a very big lifestyle change, and with that comes, learning how to manage your time in a different way, and even sometimes, behavioral modification. But the tremendous increase in health and overall well-being makes it easy for those who are using it to help manage or reverse symptoms of chronic disease or disorders, including neurological issues for the brain. That includes mental health and well-being. So for some people, the improvement is so great that it can change the trajectory of their lives. It can change their lives. And when you feel like you finally have the energy and the health to do the things you've always wanted, that is worth more than gold. That's sustainable.
Yeah, that's awesome, because people these days, they are so tired and have all the flus all the time and everything. It's so sad how people are sick these days. And this is one way to make yourself well again.
Yeah.
So I thank you so much, Erin. This was so fascinating.
Oh, I hope I answered all your questions, maybe too much.
And viewers, you can look this video below, and you will find Erin's contact info there.
Okay.
So, okay, thank you. Bye
Thank
bye.
you. Bye.